Today we're going to show you how to give an IV push medication through an existing IV line. So I have my MAR here, and I'm going to check the MAR for the patient's name, Harmon Wagner. The medication, Zofran. The dose is 4 milligrams. The route is IV push, and the frequency is every 4 hours as needed for nausea. And because this is a PRN medication, I do need to check the time of the last dose. And normally I would find that in the MAR record somewhere, but for our purposes here in the lab, I need to ask my instructor. So can you tell me when the last dose was given?
12 a.m.
Okay, so this dose was given at 12 a.m. and it's ordered every 4 hours. It's now 8 a.m. and it's been longer than 4 hours, so this medication is safe to give. And then I would do my research on my medication. So I need to check the classification, the desired or therapeutic effect, the dosage range and route, nursing implications, pre-administration assessment, compatibility with the primary IV, and any dilution requirements that there may be, and the length of administration time. So when I'm looking at this, it's to be given over 2 minutes. I also need to check my patient for allergies, and he is allergic to tetracycline. Okay. And I'm going to wash my hands before I get to my equipment and then start to gather my equipment. So I need Harmon's drawer, and I'm giving a medication, so I'm going to need a syringe and an adapter. I'll need some alcohol. Need some gloves. And I need my medication. So first thing I'll do is my first check on my medication. I have Harmon Wagner. ID 47672, ID 47672. The medication is Zofran, and I have Zofran. The dose is 4 milligrams. I have 2 milligrams per ml, so I'll have to do a calculation. The route is IV push, so I will get a syringe with an IV adapter on it. Frequency is every 4 hours as needed for nauseousness, and he had it last night at midnight. It is now 8 a.m., and so that's been more than 4 hours, so it's safe to give. Okay, so now I'm going to do my calculations. Okay, I have Zofran. The dose ordered is 4 milligrams over the amount that it's supplied in, which is 2 milligrams per ml, and that comes out to 2 mLs, so I will drop 2 mLs. And then I'll do my calculation for the amount of time that it's to be given over. And it's to be given over 2 minutes, and there are 4 30-second intervals in 2 minutes. So I'm going to divide my dose, which is 2 mLs, by 4, and that comes up to 0.5 mLs, and I'll give that every 30 seconds. Okay. So now with my calculation, I'm going to draw up my medication. So I need a syringe that's bigger than 2 mL, so I will choose a 3 mL syringe. And I'm going to put a needleless adapter on it. Cleanse the top of my vial. Inject my 2 mLs of air. And I have 2 mLs of medication. So I'm going to do my second check. I have Harmon Wagner, ID 47672, ID 47672. Medication is Zofran. I have Zofran. The dose is 4 milligrams. I have 2 milligrams per ml. As per my calculation, I need 2 ml. And in my syringe, I have 2 ml. The route is IV push, and I have an IV adapter here, a needleless adapter. It's due every 4 hours as needed for nauseousness, and it was last given at midnight. It's needed every 4 hours. It's been 4 hours since midnight because it's 8 a.m., and so this is safe to give. Okay. So my second check is done, and now I will label my syringe. Harmon Wagner, 47672. He gets 4 milligrams of Zofran, and the calculation is 2 ml. IV push. Last given at 12 midnight, due every 4 hours. I'll put that on my syringe. Grab some alcohol and my gloves. I need my MAR, so I'll take that with me. And now I'm ready to go to my patient's room after I clean up. Okay, let's go to the patient's room. Okay, I'm in my patient's room now, and I'll introduce myself. Hi, my name is Patty, and I'll be your nurse today. Can you state your name for me? And he would say Harmon Wagner. So I would take my MAR and compare his ID band. Harmon Wagner, ID 47672, ID 47672. I'm going to check his allergy band. He's allergic to tetracycline. And I would ask him that, do you have any allergies, Mr. Wagner? And we've already checked this to verify it. Mr. Wagner, today we're going to give you an IV medication through your line. And I would explain what the medication would do. Now I need to check my medication for the 3rd time. So I have Harmon Wagner, ID 47672, ID 47672. The medication is Zofran, and I have Zofran. The dose is 4 milligrams. This came 2 milligrams and 1 ml, and so we calculated 2 ml, and I have 2 ml in my syringe and no air bubbles. It's ordered IV push, and I do have an adapter, and every 4 hours is needed for nausea. He had it last at midnight. This is 8 a.m., so it's been more than 4 hours, so it's safe to give. And I'm going to put my gloves on. And I'm going to come over and take a look at the IV to make sure that it's functioning properly so he can get this medication. So I'm looking at the arm for any infiltration, any coolness or whiteness in the area, any phlebitis, redness or red streaks, and then I need to check to make sure that the IV is infusing. And it is infusing, so I want to readjust my rate to 125 mLs per hour, and that doesn't have to be exact. It just needs to be a pretty steady drip to make sure that the medication will flush in quickly. Okay. So I have my alcohol and my medication, and I want to come over to the port that is closest to the patient, and I'm going to cleanse the port. Maintain sterility. I'm going to inject my syringe right into that port. And then I'm going to check for patency. And we do that by clamping the tubing closer to the patient and pulling back on the syringe. And I'm looking for a blood return, and I see one. So I'm going to push that blood back in. And then I'm ready to give my medication. And we calculated half an ml every 30 seconds. So I'm going to clamp the tubing. And I'm going to push half an ml. So I've clamped, I've pushed, I've released, and then I'm going to check my IV to make sure it's still dripping. And then I can time my 30 seconds by the clock. And when my 30 seconds are up, then I'm ready to do it again. So I'm going to clamp, push a 1/2 ml, release, and check to make sure I'm dripping. And I am. I'll wait another 30 seconds. While I'm waiting, I can be assessing my patient for any side effects. Sometimes IV medications, the reactions you get are quicker, especially if it's a heart medication and he's on a monitor. You might see those changes right away. It's time to give it again, so I'm clamping, pushing, releasing, checking, still dripping. How are you feeling, Mr. Wagner? So the 30 seconds are done. I'm going to clamp, push, release, and the medication is done. So I can withdraw my needle. And I'm going to throw it in the sharps container. And I'm able to remove my gloves and throw my supplies away. I will readjust my rate to what it was previously. I'm going to reassess my patient for any therapeutic or side effects of the medication, and then I will go wash my hands and document. And when I document, I'm going to document the client's response, any adverse or side effects, and correctly sign off on that MAR, just like you did in the oral meds.